I'm Russ McLean, Chairman of the Patient Voices Group, and today I'm with Diane Ridgway, who's Chief Executive of East Lancashire Medical Services. They're the people who provide out-of-hours care, and to explain what out-of-hours care is, Diane.
Hi Russ. Out-of-hours care is the care you access as a patient when your GP surgery is closed. So it's for urgent or immediate and necessary treatment, not routine general practice. So if you have sudden onset of pain or something that you can't cope with over the weekend until your GP surgery is open.
And how is that service accessed by patients? Is there a number I would ring to access that?
Yep, the number is 111. So we don't take direct access patients. We don't have walk-in patients either. So you would ring 111 and they would take the details, and then 111 would appoint you, would send your number through to us, and we would appoint you to a service.
Well, that's interesting, because a lot of patients, and perhaps me included some years ago, would have thought that they're just one service, but that's not right, is it?
No. So we offer a number of services. So during the weekdays, we have an acute visiting service, which your GP could refer you into. We also have 5 centres that we run out of.
Where are they?
They are St Ives House in Blackburn, Pendle Community Hospital, Clitheroe Community Hospital, Rosendale Health Centre, and the Burnley UCC, which is the primary care part of that building.
So I'm ill over the weekend. My doctor's surgery is closed. So I ring 111, is that right?
Yeah, that's exactly right. You ring 111, 111 will take your details, they will also take a brief history, and actually they may give you advice, and that's where your consultation stops. So if you're not very ill and you could manage with pharmacy advice, or you could manage with self-care advice, then that's 111's job to point you in those directions.
Let me play devil's advocate by saying, the NHS is in dire straits at the moment. Would you agree with me that people often access these services when they don't need to? I
would say there are a lot of worried people. No more so. I've been here for nearly 10 years now, no more so than when I started, and it was NHS Direct that used to front end our calls. But what I would say is since 111 was established, that we have actually seen a higher acuity of poorly patients. So where we would have seen coughs, colds, sneezes, we now see chest infections and the patients that can't be dealt with self-care advice.
It might come as a shock to some people that East Lancashire Medical Services has been providing out-of-hours care across Pennine, Lancashire for a number of years now.
Yes, we reach our coming of age this year. We've been running for 21 years.
There's absolutely no nice time to be ill. Presumably over the Christmas period, in fact any holiday period, your numbers will increase. You'll be even busier, is that right?
Yep, that's exactly right. So yes, this is our busy period. This is coming into our busiest period. And last week, for instance, we saw over 1,000 patients. Bear in mind that we are only open from 6:30 at night till 8 o'clock in the morning during the week, and from 6:30 on Friday night till 8 o'clock on Monday morning. That's a lot of patients, and I would expect that to double over the Christmas holidays. I think what impacts on our service is obviously it's a public holiday. So this year we actually have 11 days when GP surgeries are closed over the festive season, because GP surgeries don't work weekends or bank holidays. So our numbers will increase anyway. And as a mum myself, you don't want to have a poorly child over Christmas. So you do want to access care to make sure that the fittest they can be. So I think everything is sort of heightened over Christmas. But yes, this is our very busy season.
So if I access your service, how will my GP know about it, that I've been here?
Yep. So when you access our service, your record of that period of treatment, so what you came for, what time you came, and what we gave you, so whether we gave you any medication, will actually be sent by a direct transfer to your general practice by 8 o'clock the morning after. So if you've seen us overnight, your GP practice will know by 8 o'clock the morning after you've seen us.
I'd like to talk to you now about Burnley Urgent Care Centre, which seems to be one of your more busy centres, as does St Ives House in Blackburn. But at the Burnley Urgent Care Centre, I myself have been there when patients have walked in off the street without an appointment and then perhaps realised that it might be quicker if they rang 111. Is that something that the organisation would advocate, and what sort of knock-on effect does that have when patients do that?
Well, no, it's always better to ring up first before you turn up. I think, we are very busy, but as is the UCCs, the urgent care centres, as is A&E. And actually, if I had a poorly child, I would sooner stay at home with that child and be given a time to come in. The last thing you want as a parent or an adult is to sit in a waiting room full of poorly people. If you access Burnley Urgent Care Centre, you are triaged by a nurse. Urgent care centres are for minor injuries, not minor ailments. So if you've got a cough, cold, you've headache, then you shouldn't be you shouldn't be walking into Burnley Urgent Care Centre. You should be ringing 111.
I'd like to stay with the Burnley Urgent Care Centre, and I've had a couple of, they weren't complaints, but concerns raised by patients who've been waiting a number of hours to be seen. How would you explain that? What's happened there?
Well, what's probably happening, I can't comment on individual cases, but what we see a lot of is that patients who have accessed the triage service for urgent care are told that they are a primary care case. They are then advised, or they go out into the waiting room and see the phone that says call 111. So they will call 111, and 111 will re-triage them, which is never a good pathway for patients. But anyway, 111 will re-triage them, and then they are sent to our service. So they would access the service along with everybody else. Our call handlers will ring them back and give them an appointment time, probably for Burnley, because that's where they are. But because our services are an appointments only service, they will be given an appointment time, and that could be 2 hours after they've rung. Now, if you were sat at home, it's different, isn't it? So if you sat at home and you know you've got an appointment in 2 hours' time, you would then turn up. If you sat in Burnley, there are 2 hours worth of appointments before you. So people will turn up on time for their appointment and be seen.
So if someone turns up at the A&E, we know that they're seen by clinical need. Is that the same for out of hours?
Yes and no.
If I make an appointment for I'm told I'm going to be seen at 8:30 at the Burnley Urgent Care Centre. So I turn up, I can see there are a number of patients waiting, and then someone comes in and seems to go in before me. What's happened there?
Well, that's usually because that patient has been given an appointment time and has turned up in time for their appointment and is called in, because we see people on appointment basis.
So what you're saying, in effect, is it's not a good idea to turn up an hour before your appointment, of course, because you're having to pay for car parking and all the rest of it, but you might as well be sat in the comfort of your own home until closer to the appointment time.
Absolutely, yes, that's perfectly right. Obviously, the patients are advised that if their symptoms worsen, then if they call back 111, they will be escalated, so they'll be re-advised and escalated. If they call back 111 and tell them they've rung before, they would usually get a GP, one of our GPs would ring them back and give them some clinical advice.
I suppose it would be very easy of me to say that 20, 30 years ago maybe, that patients all had their own medical cupboards well stocked, and people had all sorts of different things for different ailments. I don't think we see that these days, and I think, from my experience, that people don't self-care anymore. Is that something that you would agree with?
I as an ex-nurse, so I've been in the NHS now for 40 years, when I wasn't well or my children weren't well, I would always ask my mum what to do. I think that sort of tradition has long gone. However, I would say as a grandma now, I would say that my kids ask me, that there's always somebody around that pretty much knows what to do when, you know, your child's got a cold or a temperature, or they know the first things to do. Actually, if the patients ring 111, then 111 will provide that advice. They are very good at giving, taking patients through a triage model. They are very good at giving advice in terms of the outcomes, so whether you would need to go to a pharmacy or whether you can just manage with self-care advice. Or actually, if you do need to go to UCC. So if it's something that out of hours couldn't deal with and you do need to be in UCC, they will also tell you that too. But they will also give you access to a GP if you need a GP as well, or even if you need GP advice.
So let's recap. I'm out of hours. My GP surgery is closed at the moment. It's Christmas. It's Christmas Day. I'm not feeling very well. What's the first thing I do? Ring
111. If you ring 111, they will take you through a triage process, and then they will have an outcome. You will have an outcome at the end of that triage process. They will either call you back if they're busy, or they would ask a service to call you back. So if you were needed a GP, our GP service would call you back.
I'd like to ask you now about that process when patients do ring 111 and then are transferred to their local out-of-hours provider. In this case, it would be East Lancashire Medical Services. Patients often don't understand why they're getting asked the same questions time and time again. Can you throw any light on that?
Yeah. So when you ring 111, they will take the demographics, so your name, your date of birth, your address. Then you would be looked up. So in terms of your medical record, you would be looked up on what we call the spine, and that the details would then be checked to make sure that you are who you say you are, so we get the right patient. When that data is electronically transferred to, say, Elms, our receptionists or our call navigators will ring you back. They will check that to make sure that they're speaking to the right person, because obviously we don't know you. The reason we do that is for patient safety. So they might check your details and you might feel as though you have to repeat them, but actually it's part of the sort of risk system so that we get the right person. Now, if you've already accessed our service before, you will have a medical record that will have gone to your GP to inform you that you've accessed us. If there are details on that medical record that we hold that don't match up, we would ask you to clarify them, just to make sure we've got the right person.
Let's stick with records for a moment. There isn't, or patients might be surprised to learn that you don't actually have access to their full medical records. So basically what's happening is East Lancashire Medical Services, as the out-of-hours provider, are actually seeing some of these patients quite blind.
Yeah, that's true. If you've never accessed the service before, then we would have to create a health record. What that does basically is just documents that episode of care that you have had with our service. We then electronically send that off to your GP practice, who will add it to your medical records. We do have access, with the patient's permission, to the basic medical records, so that's what your GP would want us to see. It tends to be what medication you're on, and of course your name, address, telephone number. But we don't have access to full medical records.
Do you get many patients ringing because they've run out of medication over the holiday period?
Yep, we do. That's probably something that could quite easily be avoided. But I do understand, when patients do reach the end of the medication, that it can, I take it myself, it can come as quite a shock. I think what a good piece of advice as a grandma I would give to my children is check. So if this week, say, the week before Christmas, you look in your medicine cabinet and you think you've only got a week's supply, then it's probably wise to ring your GP practice and get a prescription early, rather than wait for it to run out.
And let's just clarify that this is not a home visiting service, so there are only certain occasions when in fact you would visit a patient in their home.
Yes, that's right. We do have GPs out on the road in cars, you'll have seen them, but patients would only get a visit if they are very unwell. So if it's the palliative care, or they're in a care home and they can't get out, it's usually the elderly.
Would you like to give a message to the patients of Pennine, Lancashire, this festive period?
Yep, I think you should stay healthy. That would be very good. If you're feeling unwell, ring 111. Even if you've fallen and bumped your head, ring 111, because they will direct you to the most appropriate service for your needs. And that may be that they tell you that out of hours is busy and they'll call you back within half an hour or an hour. It may be that urgent care centre is very busy. But happy Christmas. Have a healthy and prosperous new year. And I really hope we don't see you in my service.
Diane Ridgway, Chief Executive of East Lancashire Medical Services, a happy Christmas to you too.
Thank you very much, Russ. Happy Christmas to you.